I'm Dr. Kirsten Lewane coming to you from River Valley Chiropractic, where we teach you to move well so that you can live well. And we've had a couple patients that have been coming in with knee pain. And as we get to examining them and talking about what they were doing when this knee pain started, we're finding that they have some tendonitis in the patellar tendon. And the patellar tendon is here basically from the tibia to the bottom of the patella. It's right in there. You can feel it's kind of spongy right in there. That's your patellar tendon. So how does this come about? Well, there's different ways that you can get tendonitis in the patellar tendon, just like any tendon. But a couple ways that we're seeing it is we're seeing that either they're doing a lunge at the gym, so they're doing lunges, and they feel a, like a tear or a stretch right there in the front of the knee. I've had patients that have been kneeling for a prolonged period of time. So when you're kneeling, you're on that tendon, okay? So they're kneeling there for a certain amount of time. Maybe they were doing some activity before then, and then they go to stand up and there's pain in the front of the knee. Also squatting, you can feel it with squatting. Anything, if there's tightness or pain in a tendon, you can see that it can get aggravated with different type of movements that puts that tendon into a stretch. But is the problem actually with the tendon? Not always. Yes, the pain is in the tendon. They're having pain on exam. We go through the knee exam. We check the meniscus, we check the cartilage, we check the ligaments, we check the patella to look for chondromalacia patella, and we find that it's actually all flared up and painful down here over the patellar tendon, even some swelling in the front of the knee that spreads into the back of the knee, causing pain with movement of the knee as well. So that's what we're finding. But is it due to the patellar tendon? There can be causes other than the patellar tendon that causes this to come about. So what we find is that they often have dysfunction or tightness in the quadriceps muscle, some trigger points in there, the fascia is not gliding over the muscle the way it should, tightness, imbalance between the two legs, sometimes even in the calf as well. Tightness in the calf, their range of motion of their calf, that's restricted, as well as tightness in the muscles and that's back here in the back of the knee. So it's finding which muscles are causing a problem and causing that imbalance that then puts extra stress on that patellar tendon when they're doing these various exercises such as a lunge or a squat or kneeling and going from kneeling to standing up. So it's actually coming from a dysfunction or an imbalance in the quadriceps muscle as one of the causes. So what is one thing that you can do? Well, most everybody has one of these around home. This is a rolling pin. If you don't have one of these, maybe you have a small foam roller or something like that. But these are only a couple bucks to pick up at the store. Great therapeutic tool for mashing up the muscles. So we're gonna smash up the quadriceps where there's some trigger points and tightness and imbalance in there in order to alleviate some of this discomfort that they're finding in the front of their knee, this anterior knee pain or patellar tendonitis. I'm gonna start distally or further away from the body and come towards my body. And then I'm gonna start looking and searching for those areas that are tender and sore, working my way up from the knee towards up the thigh. And if you do find a spot that's particularly sore or junky or just doesn't feel good, and you're like, oh, that kind of hurts in there, you can hang out in there for a little bit, mash it up in there, but then continue to work up the muscle. And remember that the quadriceps muscle is actually 4 parts to the muscle. So I'm on the inside of my thigh right now, and then I can move in a little bit to the top, center, middle, as well as the top outer part of the muscle, working my way up, all the way over to the lateral or outside part of the quadriceps muscle. And I'm just pressing down with a pretty decent amount of, you don't want it to be like super painful, but I'm putting good tension on this, pressing down into the muscle and then rolling it up my thigh. This helps with circulation going towards the heart. And work on mashing up that quadriceps muscle. And what you're going to find is that those trigger points, those tight areas of the muscle, as you improve those areas of the muscle, it's going to cause less imbalance in that leg when you go to do those movements, and thus we're going to have less pain in the front of the knee or problems with that patellar tendonitis. If you have any questions regarding what we talked about here, just go ahead and pop that in the comment section below. And if you found value from this video, please like and share. And we also ask that you subscribe to our channel and click that bell notification button when you subscribe so that you have access to our future videos that are going to be coming out. I'd like to thank you for joining me here today. Again, any questions, pop it in the comments. If you found value or think this would help somebody else, please share that with this person. And thanks again for joining me today. I hope you have a wonderful day. I'm Dr. Kirsten Lewanik, and I'm coming to you from River Valley Chiropractic. We teach you to move well so that you can live well and get out there and enjoy life. We'll talk to you soon. Bye-bye.